Hi, my name is Katie Schaar. I'm a professional dancer and choreographer.
And I'm Nick Cutri, Katie's husband. I'm a licensed physical therapist specializing in sports medicine, treating athletes and dancers.
We've always had a shared passion for movement, but on my end, that passion is much more expression-based.
And on my end, it's much more science-based. We've learned a lot from each other and how our fields relate to one another. I've helped Katie and many other dancers rehab injuries, and I've learned a lot about how incredible dancers are. You guys really push the limits of human physiology to a whole new level. You utilize a much greater range of motion than most athletes, yet with the same amount of power and with even more grace and finesse.
And Nick has really opened my eyes to the field of physical therapy. Modern physical therapists are taking evidence-based research to treat their patients with therapeutic functional exercises. These exercises have the patient on their feet rather than on the treatment table, which empowers people to take control of their conditioning and recovery. Plus, it's scientifically proven to be effective. As a dancer who's used to investing so much physical hard work in my training, I immediately responded to this style of therapy, where I take my recovery into my own hands through functional, on-my-feet exercises.
Dancers should not have to wait until they have a serious injury to experience what functional therapeutic exercise can do for their health and their dance training.
The truth is, because dancers are such ambitious movers, we are very prone to injury. I have seen so many young dancers devastated by injury and so many older dancers suffering from chronic pain caused during their younger years. Nick and I want to help educate dancers on what they can do to take their well-being into their own hands. We understand that there are very limited resources out there for us. Our program is presented in individual workouts, or SFT routines, that focus on different aspects of injury prevention.
For instance, many dancer injuries occur while jumping, so we have routines that focus on retraining the body to jump in the most efficient, effective, and safe way. Each routine is a complete workout in and of itself, but also functions as a great warm-up before class, rehearsal, or performance.
Most SFT routines only take around 20 minutes to perform, so you can and should add this to your conditioning regimen. Our routines are great for individuals, and they're also great to teach to a classroom of dancers.
Sugarfoot Therapy is not intended to replace dance technique training, but to enhance it. For best results, we recommend training with Sugarfoot Therapy 3 to 5 times a week. It is important to know that our program is not intended to diagnose or treat any existing injuries. If you are injured, you need to see a physician or a physical therapist in person to receive a proper diagnosis and treatment plan.
We want to help dancers be their healthiest selves so they can do what they love and express themselves freely without the fear or devastation of injury. We hope you will join us and spread this valuable information to the dance community.